Hello everyone, my name is Sumit Suresh Achalia. Our today's topic is anti-diabetic drugs. So, drug is used in diabetes treat for diabetes mellitus by alternating the glucose level in blood with the exhibitions of insulin. Most of GLP receptor agonist, paramylitide, all are administered oral and are thus also called as oral hypoglycemia agent or oral anti-hyperglycemia agents. There are different classes of anti-diabetic drugs and their selection depends on the nature of the diabetes, age and situations of the person as well as other factors. Diabetes mellitus type 1 is a disease caused by the lack of insulin. Insulin must be used in types 1 which must be injected. Diabetes mellitus type 2 is a disease of insulin resistance by cell. Type 2 diabetes mellitus is the most common type of diabetes. The treatments including agents that at one increase the amount of the insulin secreted by the pancreas. The second, increase the sensitivities of the target organs to insulin. Decrease the rate of which glucose is absorbed from the gastrointestinal tract. Increase loss of the glucose through the urinations. Several groups of drugs, mostly given by mouth, are effective in type 2. They obtain in combination. The therapeutic combination in use in type 2 include insulin. Not necessarily because oral agents have failed completely, but in search of decided combinations of effects. The great advantages of the injection insulin in type 2 is that as well as injugated, patients can adjust the dose or even take additional dose when blood glucose levels measured by the patient, usually with a simple meters, as needed by the measured amount of the sugar in the blood. Insulin is usually given subcutaneously, either by injection or by an insulin pump in acute care settings. Insulin may also be given intravenously. Insulin are typically characterized by the rate at which they are metabolized by the body, yielding different peaks, times and durations of actions. Faster acting insulin peak quickly and are subcutaneously metabolized, while longer acting insulin tend to have extended peak times and remain active in the body for more significant spread. Example of rapid acting insulin are insulin lispro, insulin aspart, insulin glycerin. The example of short acting insulin peak 2 to 4 hours are regularly insulin, prompt insulin zinc. Example of intermediate acting insulin isopen insulin, neutral protamine hydrone, insulin zinc. Example of long acting insulin extended insulin zinc insulin, insulin glargine, insulin determir, insulin degludec. Insulin degludec is sometimes classified separately as an ultra long acting insulin due to its duration of action of about 42 hours compared with 24 hours of most other long acting insulin preparations. as well as systematic review of the studies comparing insulin determined insulin glycemia and insulin deglutition in NPH. Insulin did not show any clear benefits or serious adverse effect for any particular from the insulin from the natural hypoglycemia. So this is all about the anti-diabetic drugs. So thank you.